talk about the non-rebreather and the partial rebreather. When you guys take this mask out of your package, it's going to be taken apart into two pieces, and you'll have a couple of valves here, a valve here and a valve here. So what we're going to do is I'm going to show you guys how to make the mask into a partial rebreather and a non-rebreather. When it comes out of the package, it's going to be in a non-rebreather form, but if we ask you guys to put it into partial rebreather, you would take both your valves off, valve 1, valve 2, apply your oxygen source to the side of the bag, place it on your Christmas tree, and then you're ready to put it on the patient. So partial rebreathers and non-rebreathers are used for emergency purposes only. This is not to be a permanent oxygen source for a patient that's going home or a patient that's on the floor. This is only to be used in emergencies. So if you have a smoke inhalation patient or a carbon monoxide suspicion, or a trauma of some sort, you may see them coming in on these, but this is a temporary fix until we get them what they need. So you're going to place this over the patient's face. This is also a low flow system as well. Patient's face, tighten it like we did with the simple mask. Make sure that this is a good, nice tight seal across the nose, but not too tight. And then you're going to flatten this reservoir bag out before you increase the flow. All right, so you're going to increase your flow. Your minimum liter flow range for a partial rebreather is 8 liters per minute, and that goes up to 15 liters with an FiO2 of 40 to 70%. So we're going to turn up to 8 liters and just see what that does. Now, you want the bag to inflate, so it's probably going to need a little bit more flow. Trying to help it along a little bit. Taking a sweet time. There. We'll just expedite the process. So, we'll turn it to about 15 liters, just say. All right, so you want to make sure that the bag is fully inflated upon inspiration, and it can be up to a quarter to halfway flattened upon exhalation or inspiration. Inspiration. The reason for that is because of the valves. You are going to have a natural leak coming out from your oxygen source, so the bag is not going to stay fully inflated the entire time, and that's okay. But you want to make sure that this does not completely flatten when the patient takes a breath in, because if it does, then that means that your flow is set too low, and for long periods of time, your patient can rebreathe their CO2, and they can become lethargic and possibly code. We don't want that. So that's it for the partial rebreather. Now I'm going to show you guys how to make it a non-rebreather. So as you see here, we have no valves, no valve on the bag, no valve on the nose piece. Take your valve, put your valve on your reservoir bag, and then you're going to take your valve and put it on your nose piece. Now, some companies make them where they have 2 nose pieces, 2 valves on each side, but we kind of steered away from that because patients weren't getting high enough flows in these bags, and with the 2 valves and the valve here, they're retaining their CO2. So as a safety precaution, we have this safety port to make sure that CO2 is escaping. So once again, you're going to place this here, put it on the patient's face, make sure it's a nice snug fit, and then your liter flow range is going to be 10 to 15 liters, and your FiO2 is going to be 60 to 80%. So if you guys select this as a checkoff, it's super important that you guys remember where the valves go. Partial rebreather has no valves. Non-rebreather has both. Pretty easy. The only other thing between the partial rebreather and non-rebreather is your liter flow range. Your partial rebreather is going to be 8 to 15 liters with an FiO2 range of 40 to 70%, and your non-rebreather is going to be 10 to 15 liters with 60 to 80%. One other thing about the reservoir bag. Make sure with the non-rebreather, with the valves on, that your bag should stay fully inflated upon inspiration. It should not deflate much at all, if any, because you don't want them rebreathing their CO2, because with these 2 valves here, they don't have that extra leak for things to escape. So please make sure that this bag stays inflated at all times. Also make sure that if they're like laying in the bed, that nothing's covering this to flatten it, because over time, like I said, they can become lethargic and we've got more problems we're worried about. So that's it for the non-rebreather and the partial rebreather. If you have any questions, just let me know.